to talk about a little bit on recovery protocol and specifically on the PT side, the physical therapy side. Grappling, tons of neck injuries, tons of cervical spine, whiplash, pinch nerve, because you're shooting. If you don't get your traps elevated, whatever. I mean, like, there's so many reasons why this can happen. It happens at a high school level. It happens at the pro level. How do you work in preventative care and rehab care specifically for like cervical issues, kind of everything from the chest up?
So the nice thing is the athletes have free access to us 5 days a week. So, and someone that has had a history of stingers or neck issues, I really try to integrate in some prevention or maintenance therapy is what I call it, where they can come in maybe on Tuesday, Thursday, or after their sparring. So sometimes we'll integrate it with, depending on what their technical training looks like, but it could be like, hey, they have a really high level sparring session. The next morning they're going to come in because it's going to be a lower download day, and we're going to just do an hour session of making sure the tissues feel good, making sure the range of motion, the joints are moving appropriately, and then follow it up with a little bit of the corrective exercise and things like that to ensure that it keeps it there. So many times we see either people just do the corrective exercises or just do the manual therapy on them. And really you needed an integrated approach on that, because you can make a joint and muscles feel good, but then if you don't solidify what you've done by some activation, you're going to lose that. So, or you might just do activation and they're in this horrible posture and their joints not moving at all, and you're doing that for the wrong reason. So, I really first and foremost make sure there's recovery going. And recovery is very different dependent on athlete, right? Some people like certain things. Some people like new fads that are coming out and they think this is the end all be all. Other people, I think, just daily maintenance treatments. That's something that people don't love to get done. Like, why do I need to waste an hour? But I'm like, maybe make it on your Wednesday afternoon. Like, I always try to get these athletes to take a Sunday off and like a Wednesday afternoon. So I'm like, load your Wednesday morning, and then Wednesday afternoon come in and let's do some maintenance. Let's do corrective stuff and things like that. Sliding in prevention into our S&C warm-ups and programs, that's another way we do it. And then always talking about kind of that athlete, what their unique needs are with recovery. The new fad thing is everyone do the cold tubs, right? Everyone get their own cold tub at their house, jump in it. But there's science and research for that as well. There's a time and place for it,
Yes.
And that's really what I think, to get across is the why. Like, if you're a hypertrophied state of a training session, you're trying to build this because your strength and power is crap when it comes to your opponents.
Stay that way for a little.
Right, like, you need to get that and build that, because if you just jump in an ice bath right after you've done that, you're not getting the gains. But if you're doing an ice bath because you want mental training, because you're doing a quick recovery on a day, awesome, cool, but understand the why of why we do these things. Same thing, all my athletes are jumping on the hyperbaric chambers. And again, looking at evidence, there isn't evidence that actually shows it improves injury recovery. Does it improve? Yes. Wound closures. We've seen it for years and years. There's research from the 30s and 40s of diabetic wounds and things like that. Diving issues. Have we seen it improve concussions and brain injuries? Heck yeah. And the evidence is great. But when it comes to saying, hey, it's going to take this ligament injury from 8 weeks of healing to 4 or 6 weeks, there's no, we're doing a discussion today, like a TED Talk with the team, to everybody had to pull as much evidence as possible to see what's out there. And then this is the evidence I can present to you guys as athletes. Obviously, you're going to do with it what you want to do with it.
Right.
But start to learn the why. And I think that's what all athletes need to look at. Why am I doing the warm-up I'm doing? Why am I doing the S&C? Why am I doing the prevention or the maintenance that you're telling me to? When you understand the why and there's a purpose for it, then I think that's when you really have hit home on what performance is about and what the needs and individual needs are day to day of that athlete.